year's theme is breaking barriers and bridging gaps. And we are here to do that, to address the various dilemmas that we have in managing this disease. And joining me today is Dr. Shweta, who's a diabetes expert at Bridge Health with over 13 years of experience. Welcome, Dr. Shweta.
Thank you so much, Dr. Dhanya. It's wonderful to be part of this important conversation. I know it is little overwhelming at present when we hear the word diabetes, right?
Yeah,
But I think so we are going to keep things as simple as possible here, and we are going to break down the basics here. So let's get started.
All right then. So when I was, preparing for this talk,
Mhm.
I came across some eye-opening statistics.
Mhm.
Right? So there are over 101 million people living with diabetes in India.
Mhm.
Right? So that's around 11.4% of the population.
Mhm.
That's a raging big number.
Mhm.
Even in my practice, I presently see a lot of patients walking in with a diagnosis of diabetes.
Mhm.
So we know that the disease is an epidemic, but such raging numbers, isn't it alarming?
Yes, it's alarming. And what's even more worse is that lifestyle factors are the one factors that is contributing to this epidemic, right? So, were you aware that in 90s when there was introduction of the cable TV,
Yeah.
and there was a market use of increased usage of the TV during that time.
All right.
So that has led to more of sedentary lifestyle, lack of physical activity, and I think so that was one of the most important factors for the rise in the epidemic during that time.
Right.
Yeah.
All right. So that's a shocking,
Mhm.
trivia. But it's not unbelievable, right?
Mhm.
Like, so you're sitting in front of the TV and therefore you're sedentary and therefore,
Mhm.
yeah.
Yes. So yes, as we know that cable TV is one of the breakthrough that has caused the rise in the epidemics. Other thing is I would say that is like a more processed calorie, more high calorie and high dense food, which is nowadays available at more convenience and more of the cheaper rates, right?
Yes.
So anyone can access rather than cooking healthy foods at home, so they can access at more convenience the cheaper, the more calorie dense foods.
Yes.
Other thing is we are seeing the rise in the younger group of people for the diabetics. That is because of the increased performance in the academics rather than going for the physical activity.
Yeah, so
Right.
that's true. According to the American Diabetes Association,
Mm-hmm.
all children and adolescents, right,
Mm-hmm.
with or without diabetes,
Mm-hmm.
must get at least 60 minutes of moderate or vigorous physical
And that's
activity
very
every
difficult
day.
nowadays. Yeah.
Yeah, so we see that
Mm-hmm.
children these days don't have this form of exercise, and along with the high calorie diet,
Mm-hmm.
this is a start of the risk factors for adult diabetes, and therefore developing diabetes younger itself, right? Because your risk
Mm-hmm.
factors have started in childhood.
Yeah. So I think so that is because of the increased lifestyle expectancy. So in the previous years it was around 56 years, and now it has increased to 70 years, right?
Yeah.
So that is forcing more years to spend in the sedentary lifestyle. And as your age increases over, obviously your metabolism will also decrease.
Correct.
So decrease in the basal metabolic rate along with the sedentary lifestyle is again the very important factor to increase in the epidemics.
Oh, all right. So, but thankfully,
Mhm.
everything is not grim, right? There is a silver lining. So, with this raging epidemic, there has been a lot of research in diabetes,
Mhm.
and which has empowered a lot of people with the right knowledge and the skills to manage their disease.
Mhm.
But wherever there is knowledge, there are also a lot of wrong information and
Yes.
misunderstandings,
Mhm.
and we come across this in our daily practice, right?
ऑब्वियसली डॉक्टर एग्जैक्टली डॉक्टर धन्या सो आई विल से मेरे पास पेशेंट्स आते हैं डॉक्टर आज हमने चाय में चीनी बंद कर दिया है आज हमने बिल्कुल
Yeah,
स्वीट्स
I've heard
खाना
that
बंद कर
too.
दिया है सो आई थिंक सो पीपल आर हैविंग दैट सर्टन डिसबिलीव दैट अगर शुगर से ही डायबिटीज होता है अगर हमने स्वीट्स खाना बंद कर दिया शुगर खाना बंद कर दिया तो हमारा डायबिटीज चला गया है बट आई थिंक सो दैट इज नॉट द ओनली वे टू प्रिवेंट एंड मैनेज द डायबिटीज देयर इज अ लॉट मोर टू नो अबाउट दैट आई थिंक सो वी विल discussing that ahead for that part.
Yes,
Right?
yes. So let us start with that. Let us bust
Mhm.
some myths, right? And let us start with the statement that you made. So most people say that if you eat a lot of sweets,
Mhm.
you get diabetes. There is a truth to it, but how do we understand that better?
Mhm.
Let us break that down.
So, okay, before going into the myth, before debunking this myth, I will always love to explain what is glucose.
Mhm.
So, what
Yeah.
is a glucose? What is a sugar? So, and from where the glucose comes, right? So, glucose is the main source of energy in our body. Each cell in our body needs the glucose, right?
Correct.
And we are burning that glucose every nanoseconds, every
Yeah.
milliseconds. And this glucose is coming from the two types of foods, whatever the foods we eat. First is the carbohydrate rich foods. So
Yes.
anything you eat, roti, pasta, rice, any tubers or potatoes.
Correct.
Or it can be just from your simple part of the cake or fruits or even the juices also, right?
Yeah.
So what happens when it gets break down into glucose? So our body is having very clever mechanism, right? So whenever there is excess in the body, our body wants to throw it out or wants to control it in any form. So there is an organ in our body that is a pancreas.
Correct.
Right? So from the pancreas, insulin is getting released at that part.
Yes.
When the sugar is getting enters into the body. And this insulin, what it will do, it will take your glucose from the bloodstream to the cells. So it acts as a lock and key.
Yeah.
Right? So where the cell acts as a lock and insulin acts as the key.
Yes.
So only if the insulin opens that cell with the key, that glucose will enter into the cell.
Correct.
So, and where this glucose is further utilized in the liver, your skeletal muscles and your fat cells further for the energy. Right? So what happens when you're taking too much of glucose? Right? So I will explain it with very simple example. Okay, when you are born, so think you are born with a big bowl, right? And that is empty. There is no sugars in that. Over the decades, you keep eating junk foods, you keep eating carbohydrate-rich foods.
Not a large amount.
Yeah, so that it will get filled up. And certain point, the point will come when the sugars will start overflowing from that bowl.
All right.
Right? So what happens then? There is an overload on the pancreas. So and pancreas has to produce more of insulin.
Correct.
So pancreas is bombarding your cells with the more and more of the insulin. And this is the part when the insulin gets tired. And in the layman term, right, I can say insulin gets tired, but that is a more of insulin resistance we see.
Correct.
Right? So insulin resistance is something when your cells of your liver, skeletal muscles or fat cells doesn't respond well to insulin.
Yeah.
And this excess glucose will start flowing in your bloodstream. And that is caused the increased rise of the sugars. And that's when we diagnose it as a diabetes. Right? And I think so obesity, again, if there is any inactive insulin in your body, it will cause the more fat storage in your body. So there is a vicious cycle. More fat storage, more insulin production, more insulin resistance. You will getting obesity, inflammation in your body, right? And that is again the increased risk factor for your diabetes. And I think so, Dr. Dhanya, I was just reading some articles. So some international studies have come up. So if you cut down the sugars in first 2 years of your life, right? Like from the conception to 2 years of the age, the childhood.
Okay.
So that can decrease your risk of 35% in the diabetes.
Oh, all right.
Yeah.
That's quite informative, isn't it? I mean, that's like from conception to 2 years of age.
Yes, from conception to 2 years of age. And mothers comes to me and they say, okay, हम बच्चे को इतना sugar देंगे, उसमें healthy weight gain होगा, so he will grow better. But I think so. This is just a myth. So we should not encourage mothers to put extra sugars in the cereals or in the foods, or give them the junk food when they're young.
Yes, and as early as from conception. So that's very important. That's useful information. So, of course, now we know that diabetes is multifactorial. That means it's not only about eating sweets, right? Which is commonly believed. So there are a lot of other lifestyle factors like inactive lifestyle, chronic stress, lack of sleep, taking a lot of excess products like alcohol, smoking. All these can pose as risk factors for diabetes. So it's not as simple as saying that if I eat a lot of sweets, I will become diabetic, right?
Yeah.
So that's good. So that brings us to the next myth that we have, or a fact you should tell us. So a lot of patients, and you must have heard this, coming to us saying that my parents have diabetes and therefore I will also invariably have it. So what weighs more? Is it genetic or is it the environmental factors?
So see, type 2 is the most common form of the diabetes in India. I think so 90% of the population in India is a type 2. And type 2 is further determined by two factors. That is the genetic factors and environmental factors.
Yeah.
So genetic factors is only 10 to 20%. And environmental factors or lifestyle factors is 80 to 90%. And there is a common saying you must have heard, Dr. Dhanya. So there is like genes load the gun, but the trigger is pulled by the environment.
Yes.
right?
Yes. Yes.
So when you are born, there is already you are having the predisposition of getting the diabetes. So
Yeah.
genetics is like 10% already is there in your body.
Mhm.
So, but when you start living the unhealthy lifestyles, like eating unhealthy food, not doing proper physical activities, stress or sleep, so that is your environmental factors. So that was the trigger, and then that's when the bullet is fired,
All
right?
right.
So this is not only the genetics that rules the factors. Obviously, your lifestyle factors are the also plays an important role in that.
All right. So that's a very good saying, and that's very
Yeah.
well put. So it's not the genes you cannot choose, but at least your environmental factors or your lifestyle factors you can choose. So
Yes.
that's well put. So that gets me to the next question, and this is something that most people have a false reassurance. So when I tell them about diabetes developing in them, showing them their risk factors, they say that my parents got diabetes when they were in the 70s and 80s, and they somehow are falsely reassured that they will not get it young, which is not the case, because we are seeing a lot of diabetes occurring in the younger age group in between the 20 to 45 years. So what do you have to say to that?
So as you have seen in our common practices, nowadays the patients are not solely the older people like 70 to 80 years old who are coming to
Yeah, which was in the
us.
past.
Yeah,
Yes.
which was in the past. So I think so most age group we are seeing nowadays rise in the cases is around 20 to 45 years. So, and most patients are like diagnosed with the pre-diabetes or the diabetes with a high sugar levels.
Yeah.
So I think so, yeah, it is not the solely the disease of the old age, but yeah, in
We
the
are
younger
seeing it in
age,
the
yeah,
younger age
we
group,
have
and
seen
it's
this.
quite an alarming number.
Yeah.
If you ask me,
Mhm.
1 out of 10 people coming into the OPD is a diagnosed diabetic,
Yeah.
and apparently in the next 5 years, that's going to be 4 in every 10, and I mean that's quite worrisome,
Yes,
right?
yes. So as we have seen, we are living in the Bangalore, the city of convenience, right? Where everything is available at the blink of the eye or the click of the button, right?
Correct.
And like the fast paced lifestyle, stressful lifestyle, and all these are the factors that is leading to the increased cases of the diabetes in the younger population also,
Yeah,
right?
yeah, that's true.
So Dr. Dhanya, I just want to ask one question. Does the stress also causes the diabetes or is also the predisposing factor for the diabetes?
Yes, so this is again a common question or common statement that patients make, right? So I had a period of stress and therefore I became diabetic during that period, and this is not a myth. To tell stress causing diabetes is truth. So stress has a very important influence on your blood sugar levels. So to explain this, I can explain this in two forms. One is the physiological effects, and one is the behavioral effects of stress, right? So if you consider the physiological effects, when you have an acute stress, it can be any stressful event, right? So when you go through the stress, there are stress hormones released in the body, which is cortisol and adrenaline. These are the stress hormones. So these hormones increase your sugar levels. And why does it do it? It wants glucose to be present as energy so that you can combat the stress, right? So that happens during acute stress, which is helpful for the body. But suppose the stress becomes chronic. So there is constant release of these stress hormones, and therefore there's constant release of sugars. So what happens? The cells become insulin resistant, what you talked about before,
Yes,
right?
yes.
The lock and key mechanism where there is insulin, there is blood sugars, but it's not able to stuff it into your cells. And this can happen over time with chronic stress. Also, we know that chronic stress causes inflammation. And we know that inflammation also raises sugar. A lot of people with inflammation, diabetics, their sugar levels go uncontrolled at that time.
Yes, yes.
So all these factors as physiological factors are responsible for increasing blood sugars when you're stressed. So what are the behavioral factors? So some of the things we would be able to relate to, which is when you have a stressful situation, like we had just before the talk,
Yes.
stress makes you want to grab a
Yeah.
bar of chocolate and eat it, right? Not that we ate one before the talk, but I'm just saying. So stressful situations may make you want to take up bad choices of
Yeah,
food,
food
especially,
choices.
right? So you crave for high fat food or high carb food, and mostly the things that are available are junk and processed food. So this can increase your blood sugar levels over time, and if you're stressed all the time, you're making poor choices all throughout.
All through that,
So that's
yeah.
something that it's a behavioral pattern. And also that stress can make you fatigued, and also the fatigue can give you less motivation to move. Therefore your physical activity is less,
Yes.
right? And that can also be caused due to chronic stress.
Yes.
And chronic stress has also seen to cause sleep disruption. So your sleep quality is poor. Again, there is cortisol increase, and your blood sugars go up. So all these happening not 1 or 2 days, but over a period of time. And that is why we see it in the younger age group, who are all the stressed workers. I mean, they're quite stressed about life in general also. So this can have an impact on their blood sugar levels and developing diabetes early. And therefore, you would see any doctor, health coach advise you about being mindful, having mindful practices, doing meditation, yoga. All these are to be able to cope with the stress that our lifestyle brings these days.
Yeah. And as you know that cortisol is again anti-insulin hormone.
Yes.
Right?
Yes.
So if your cortisol levels are high, so obviously your insulin levels will go down.
Yes.
And it will cause increased sugar levels indirectly. Right?
That's true.
Yeah.
That's true. So now that we have established that diabetes is a lifestyle disease, and it's not only that if you eat a lot of sweets, and it's not that with age you have to get diabetes. So these are some of the myths that we've debunked now. So what is that you would tell your patients, Dr. Shweta, who ask you, so what should I do to prevent diabetes and pre-diabetes?
So whenever the patient comes to me and say कि डॉक्टर हमें कोई शॉर्ट फॉर्म बता दो जिससे हमारा शुगर कम हो जाए, मैं कहूँगी उसका तो कोई शॉर्ट फॉर्म नहीं है, but to remember this, there is one short form, that is new start, I say.
All right, new start. What is that?
So N starts for your nutrition. So nutrition plays a very important role in managing your sugars.
That's true.
So if your diet is not proper, there will be improper glycemic control, lipid controls, and your weight will not be under control. So diet plays important role for glycemic, lipids, and your weight management.
Yeah.
So include foods which are rich in complex carbs, fats, adequate fibers, and more of proteins, right?
Yeah.
So there is always a healthy plate concept, we say. So this much should be the carbohydrates, this much should be the proteins in your plate, and fat should be there, right? And other thing is always avoid the processed foods, avoid excess sugars in any forms, right?
Like added sugars.
Avoid added sugars in any form. Again, the salt intake, it should be less than 5 grams per day. And again, I will say that portion control is always the key. You have to control whatever you're eating in your plate. Just look into the plate. It's not flooded with the carbs and all that things, right?
Yeah.
And proper spacing of the meals is always important. Right?
All right.
The second point comes is the exercise. Exercise plays an equally important role as a diet.
Yeah.
So always remember the frequency of the exercise. So you should be doing at least 4 to 5 times per week, right? The exercise intensity should be moderate. And again, the timing of the exercise is important. At least 30 to 45 minutes of the exercise, or at least 150 minutes per week you should be doing the exercise.
Yeah.
And type of the exercise. What type of exercise you should be doing? There are 2 types of exercise. I always tell my patients, okay, anything walking also will help you keep moving and regulate your sugars levels. But combine aerobic exercise with the strength training exercise. So aerobic exercise is something that burns your fat. Anything which utilizes oxygen from your body, right? Anything from running, swimming, cycling, any form of that which increases your heart rate is an aerobic exercise.
Correct.
And the second one is a strength training, right? So once you are losing the fat, it's very important. You should not lose your muscle mass.
Yes.
Right? So you should be there having the proper toning of your muscles.
Yes.
And the muscles is the one part for the insulin resistance.
Correct.
Right?
It is the organ of longevity, isn't it?
Organ for the longevity. And strength training can be in any form, your free weights, free functional weights, elastic bands, anything, but always you should be doing in the guidance of your healthcare provider. You should not go up and lift suddenly 10 kgs of the weight.
So
right?
it's not about just going and joining yourself in the gym and doing the wrong thing and getting hurt as well, right?
Yes. Other thing is W starts with, as we are talking about the new start. So in that W comes for the water, adequate water intake. So anything from the 3 to 4 liters of water, again depending on your lifestyle and everything. So that is very important, right?
Correct. So a lot of people don't feel thirst and they say that how to drink this 3 liters of water, right? Most of us are inadequate on that. So I always tell them, watch the urine, right? So if the lighter the urine color, that means you're drinking enough for that environment or the weather, right?
And S part comes for the stress and the sleep, as you have explained it very well, that how the stress and the lack of the sleep affects your sugar levels. And T is the temperance, temperance to use the good things in the moderation and avoid any bad things.
Yeah.
So bad things, avoiding the excessive of the smoking, alcohol,
Yeah.
or tobacco usage, right?
Habits, yes.
Any of the habits can be the temperance.
Mm.
Again, A comes for the air.
Mm.
Air is the very essential element for our breathing.
Yeah.
So I always tell my patients go for some deep breathing and relaxation techniques,
Yes.
right? So that's very important to keep your stress at bay,
Yes.
and to keep you de-stressful and control your sugar levels.
Yeah.
And again comes the rest. Rest and recovery is very important. If you're not
Correct.
giving your body the proper rest and recovery, you're going to the toss.
Yes.
Right?
Body and mind, I would
Yeah,
say.
body
Yes.
and mind is going to the toss.
Mm.
And the T again comes, take control of the things, right? Trust in your abilities, right? That you can control and prevent the disease and get empowered with proper knowledge.
Correct. Correct.
Right?
That's very simple and I think very easy to recall, right? So
Yes.
all of you should remember the new start. So there is one angle where we have told them how to prevent diabetes or pre-diabetes for that matter. But it's also important for us to screen for this, whoever is at risk, because sometimes, like you said, 10%, 20% is the genetic load. So who are the people at risk, and how do we usually screen them?
Okay, so screening is like the mirror for your body, right? So whatever is happening in your body, you're not knowing what's happening in the body. And one fine day, the patient comes to me with all the complications of the diabetes and everything, right? So it's very important to screen the patient. So screening is the tool for the undiagnosed diabetes, right? So whenever the patient comes in the early age. So there is a very simple and effective, cost-effective tool, 2-minute tool that is approved by the ADA, that is IDRS. So it is Indian Diabetes Risk Scoring System.
All right.
Okay.
IDRS. Okay.
So IDRS is the Indian Diabetes Risk Scoring System. So again, the 4 components comes in that. First is the age. If your age is less than 35, you are at lower risk. If your age is more than 50, you are at higher risk. The second part comes the physical activity. How much exercise you are doing daily. As I already told, the 4 components of the exercise:
Correct.
frequency, intensity, time, and the type of the exercise.
True.
And the third part comes the genetics, right? Your father is a diabetic, your mother is a diabetic, or both of them are the diabetics. So again, there is a different scoring system for that.
Okay.
And fourth part is your waist circumference. That is your pant size.
Correct.
Right? So anything in the males, it should be less than 90 centimeter.
True.
And in the females, it should be less than 80 centimeter.
All
So
right.
that is a normal part. Anything more than or above that puts you at the risk for the diabetes.
All right.
And again, the scoring is like divided into, if you are having the more scoring of more than 60, so you are having the very high risk of getting diabetes.
All right. So this categorizes people into certain risk groups.
Yeah.
Who would also, maybe for health providers, we could suggest that who would want to get screened more often and who could less, right?
And 30 to 50, if anything is there, it is a moderate risk. Less than 30 is a low risk for the diabetes, right? So and any person who is diagnosed as a diabetes should go detailed physical examination, physical examination of height, weight, their BCA, that's a body composition analysis, right? That's very important to know how much is the weight of your, and how much is the protein in your body and everything.
And the muscle mass
And everything. And other thing is the waist circumference, as I already told, waist hip ratio.
Yes.
And detailed lab evaluations. Okay, so to know which type of diabetes they are having, how much is their glycemic control, and whether they are at the risk of any complications.
Yeah.
Right. And what are the tests usually we do for the screening is the fasting blood sugars. So fasting blood sugars less than 100 is a normal. Anything between 100 to 126 is a pre-diabetes.
Correct.
And more than 126 again is a diabetes. But again, I will say this is not the only solely factor for diagnosing the diabetes.
Yeah.
There are a few other factors for that. And the second one is the PPBS, that is the postprandial blood sugars.
Yeah.
Anything ranging from 120 to 140 is normal, and anything above that is abnormal values.
Yeah.
And again comes the 3 months average of the sugar controls.
Correct.
So that is a glycated hemoglobin, we say, that is HbA1c, right?
Correct.
So we check every 3 monthly how much is the sugar control. So less than 5.7 is a normal, we take it as a normal criteria. 5.7 to 6.4 is anything, we say it as a pre-diabetes.
Yeah.
And if it is more than 6.5, we say it as a risk for the diabetes, or it is diagnosed as a diabetes.
Correct. So HbA1c is a very imperative test, and I would say all people who need to be, adding this test in their regular checkup, because it gives us an average of the last 3 months. and it's usually done every 3 months, but
Mhm.
it's also dependent on what your present levels are,
Mhm.
and also your doctor's advice on how often you should repeat it, because if it's
Mhm.
well controlled, you may not need it every 3 months also,
Yes.
right?
Yeah.
So, Dr. Shweta, we've talked about the risk scoring, and we've also seen
Mhm.
what are the laboratory tests that are available and the
Mhm.
physical examination. Of
Mhm.
course, there's a lot of importance on all these,
Mhm.
but there are also monitoring tools that are
Mhm.
available. There is new
Mhm.
technology around it. So, would you like to tell us about the SMBG, that is the self monitoring of blood glucose, and the CGM,
Mhm.
the difference between the two, and how effective are these for monitoring?
Yeah. So whenever the patient comes to me, okay, we have diagnosed the patient as a diabetes. So it's very important to check your sugars regularly, right? The patients are not coming and checking sugars regularly. They told, okay, doctor, हमने 3 महीने का HbA1c करवा लिया, हमारा sugars इतना आया है. So
Hmm.
that is not the only way to check the
Yeah.
sugars. You should be checking sugars regularly
Yeah.
at the frequent intervals
Yeah.
to know what is the variation in the sugar levels, right?
Mm.
SMBG stands for self-monitoring of the blood glucose, right?
Correct.
And this is a prick method in
Mm.
which the patient pricks themselves. It's just not a painful method, but
Mm.
little prick will go
Yeah,
into your
multiple
hand.
pricks,
Yeah.
yeah.
So and you can check it with the capillary blood glucose
Mhm.
meters nowadays. It comes various types are coming nowadays in the market.
Yeah.
Right. So this is the one method to check the glucose levels. Other method is a CGM.
Mm.
So CGM is something called as a continuous glucose monitors,
Correct.
in which continuous glucose monitor itself explains the word that is continuously monitoring your glucose levels.
Mhm.
So it gives you real time insights,
Yeah.
right? And it is a painless procedure,
Mhm.
right? You don't have to prick every time. So there is one device that is fixed on your arm,
Mm.
and it's completely painless, and where it will be checking your sugar levels. And CGM gives you real time insights regarding your food, your medications, your stress, and the sleep, how your sugars are getting altered or according to that.
All right. So,
Yeah.
I mean, how far diabetes has come in terms of
Mhm.
their technology as well,
Yes.
right? So, this is really empowering to
Mhm.
know. Tell me, Dr. Shweta, can anybody use a CGM, or is it only for diabetics?
Okay. So again, Dr. Dhanya, I will say that CGM is not the something that fashion device. Okay, you are going to put everyone in everyone's arm, right? So you should consult your physician before putting the CGM, right?
Yeah.
And so CGM is mostly for the people who are diabetes, like type 1 diabetes or type 2 diabetes, anything with the gestational diabetes, right? Athletes who are diabetes or not diabetics, right? And again, the health conscious people who want to monitor the sugars according to the diet, or like who are obese or fat people, right? They want to see their sugars are getting fluctuated with the what food is getting the fluctuate the sugars. Again, I will always say that please, whenever you are putting the CGM, always consult your healthcare provider. Always take them in the loop, right? So they should be knowing, and accordingly can modify your lifestyle modifications and your medications according to the CGM.
Correct. So in a
Yes.
country like India, I think we have availability of
Mhm.
this device, and a
Mhm.
lot of people are health conscious, like you said, right? So they
Mhm.
would want to know what's happening in their body,
Mhm.
and this is one way to monitor that.
Yes.
But like rightly said, you need to have a healthcare provider team behind this. So that could be your doctor, it could be your
Mhm.
nutritionist. So any technology without knowing how to use it is actually quite dangerous, right?
Mhm.
So I think that's rightly said, that if you have a team that can give you insights on how this
Mhm.
monitoring and what it means, you can make some tangible changes to your lifestyle depending on your CGM
Mhm.
readings. So
Mhm.
that's really good. So
Yes.
yeah. So I think we've talked about the risk factors. We
Mhm.
have busted a lot of myths,
Mhm.
and we've also, undergone. I mean, we've talked about risk scoring and screening tests, right? So this brings us to the end of our conversation today, and
Mhm.
there is a few messages that we would want to give out. So know that your health is in your hands, right? Empower yourself with knowledge to make conscious decisions on maintaining your long-term health. So, tiny habits and rituals can go a long way in your overall health. So, these habits can be good or they can be bad. So, the choice is in your hands. So, I hope, and Dr. Shweta as well will accompany me in hoping that all of you make wise and good choices for a better you. Thank you so much for joining us today on this podcast. And presently, we will be flashing a number on the screen, and we would, people who want to get in touch with us and understand more about whether it's monitoring CGM or a metabolic health program, or talking with Dr. Shweta as well, can contact that number and reach out to us. So thank you so much to everyone for joining us today.
Thank you
Good
so
evening.
much.